Good morning. Yes, Honorable Representative from the Ministry of Health and the Rwanda Biomedical Center, esteemed leaders from the Pfizer Foundation, and distinguished health experts, health leaders, patient advocates, a very warm welcome to this technical roundtable to advance breast cancer.
It's a big, great pleasure for me to be here. So I think today we are going to probably explore how we can strengthen the partnership across sectors to accelerate the progress in breast cancer care. And I look forward to a very engaging discussions as we share ideas.
The fact that everyone here, and as Sandra said, we've all been impacted by breast cancer, whether it's families and friends. And so the showing of everyone here, it's very humbling to me because it shows really the commitment, the deep commitment that we all have for improving the health, the well-being and the lives of women with breast cancer in Rwanda and beyond. And I know that we can work together to improve that even further.
Thanks to the collaboration with our team and partners, we have worked together to make sure that we elaborate the second version of National Cancer Control Plan. This time around now, we want to put much effort in breast cancer, whereby we focus on early detection to make sure that we can do diagnosis, treatment, and survivorship.
We will put a lot of efforts now to build our capacity in the diagnosis. Because we'll do a lot of investment to actually equip our histopathology laboratory, both Kiputari Hospital and Sashibin. And with that, we'll use that foundation actually to build a strong network of our labs.
We need to find optimal public health impactful avenues in order to engage with communities. Education is very important, and I completely agree, awareness is important. But it also has to be built on a care system that's effective.
So when we target the community, also men should be targeted. Make sure that we tackle the problem from both sides. Thank you.
So for me, considering that everything starts at the moment when you have a diagnosis, isn't it? Because we can't be talking about breast cancer if you haven't achieved a diagnosis. I think that should take a lot of considerable amount of our thinking and our planning and our resources. The good thing though is in the same presentation, he mentioned some of the interventions, and that included increasing the capacity of labs, histopathology, and also the human resource.
And we think that continuing to build these support networks in the communities is a great tool to ensure that with the community we understand we have a population that is educated about what the risks are and how they can mitigate them early on as much as possible.
Expertise, different resources, and different access to infrastructure, kind of staying in our lane, but driving towards the same goal. I think that often there's that duplication of efforts and that waste of kind of the expertise. So if we all stay in our lane, but do stay in Mogozume will be amazing.
So and I think let's continue working together to turn the discussion of today into tangible and practical actions. Thank you so much. It was a very honor for us as RBC to host you, and great keep in touch. Thank you.